Good morning. To prevent the brain from further analyzing and from further overthinking, the brain should have as a priority to know for sure, the brain should know for sure that this is not real, that these thoughts are not real, that these thoughts are obsessions or are OCDs, are false brain signals. If the brain suspects that these informations, that these thoughts or triggers are true, if he suspects that, then he will initiate an analyzing response. So it will try to analyze and check and analyze and overcheck and overanalyze and analyze so that he can reach the truth. He can check or test if it is a false signal or a real signal. So in this point of view, we should not see a difference between an OCD person and a person who don't suffer from OCD. Both of them, if they see a real lion, if they see a lion, then they should respond in the same way. Both of them should do something, should have the urge to do something. They should do something because otherwise they will be eaten by this lion. So as a priori, as a first step, the brain should know if this lion is it true or not. If this is an image of a lion, of a real lion, it should know from the beginning. This is why we have the first step. The first step is to tell the brain that that what you are having now, because we have said that relabeling, okay, or labeling should happen at the onset of the obsession. When the obsession is entering your consciousness, then you will begin to label. You will say, this is OCD. So, yeah, this is why it is important, so that the brain knows from the beginning that it is an obsession. This is an OCD. To prevent, why? To prevent a further analyzing this thought, to prevent a further analysis of this thought and further involvement and further over analyzing. And if you analyze, then you will give it a focus. You will give the thought a focus. If you give the thought a focus, then it will be bigger and bigger, and the monster will, this we call this feeding the monster. Okay, so it is very important to tell the brain from the beginning that this is an OCD. That means that this is a false. What you are beginning from this step in time, you are telling your brain this is false. There is nothing. It's simply an OCD. It's simply a false signal, a false brain signal, a deceptive brain message. Okay. When the brain will know that, then it will try to stop further analyzing. It will try to stop over analyzing, checking, giving more focus and importance to this thought or message. Also, if the brain knows that this signal is false, that this urge is false, that this thought is false, that this thought is an OCD, then it will also decrease its desire to get rid of this thought, because this thought is a false signal. It is nothing. It is not true. This lion is not a real lion. This is an image. This is a thought of a lion. So the inclination to initiate the fight or flight response will be decreased, or there will be no fight or flight response. It depends on when you are in the stage of the therapy. Okay, also this desire of getting rid of the obsession, getting rid of this thought as soon as possible. This as soon as possible is very important, because the more you want to get rid of the thought, of this terrible thought, as soon as possible, the more you will say to the brain that this is a true thought. This is why I want to get rid of it as soon as possible. Then the brain will know that, oh, this is an important thought. Each time there is this thought, or something that look like the thought, then send them a signal. The brain will send you a signal to warn you that the danger is coming. This is why we say label it as an OCD, label it as a false signal. OCD means a false signal. You label it as OCD. Then the brain will know that. Okay? Because we have said many times, what gets you deep in the problem is not the OCD signal itself, is not the thought, the OCD thought itself, is not the terrible thought itself, but your response to this thought. Your response to this thought, what gets you deep in the problem until now, what gets you deep in the OCD. The response to this thought, okay? So when you label it, then the brain will know that, oh, this is a false thought. I don't need to overanalyze. I don't need to give a lot of resources, time and energy to analyze, to focus, to get deep in the story, and thus he will remove the energy, he will lessen the energy step by step and break the focus. Okay, so he will get from the beginning. This is why it is the first step. From the beginning you label. From the beginning you label, so that you know that, so that your brain will get a sense, will get a feeling, will know that this is not a true image of a lion, that this is a false information, that there is nothing. It is simply a chemical or a electrical signal that has no meaning. So after you relabel it, then as an OCD, then the brain can go further and focus on something that it is an important goal or an important value, important goal that comes from important value. Okay, now let us take a taste of the therapy. So let us say you get an OCD urge or OCD signal to check the door, or you check your pulse, your heart, or an OCD signal to clean something, or to repeat your prayer, maybe, if you're a religious guy. Or maybe you get a thought that you are a gay or a homo, or that you should go back to the last traffic light and check if you have killed someone, to the last bump to check if you have killed someone. If you got one of these, or maybe two of these signals, then quietly in yourself, without any sound, say this is an OCD, and then focus on something important. Uh, and this, so now what you have done is step one, step three directly. So you label it, you say to your brain, this is an OCD, this is a false signal, this is an OCD. So you say to your brain, this is an OCD, and then you refocus on something else. Okay. Some clients can do that, especially so this step one and directly step three without step two. We will come in the next videos to step two. Uh, Step two will touch the content, the story of the OCD, and sometimes it it goes more than the content, especially in the exercises of step two. But if you have, it is very important, if you have a mild form of OCD, so a soft form of OCD, say, uh, not very hard, not long time, long period, very hard OCD, a mild form of OCD or a mild form of obsession, any obsession, it doesn't have to be an OCD, of repeated obsession and repeated intrusions, then you can use this method. It is very helpful and it is a very good method. So you relabel it, you label it as an OCD, you label it as a false thought, you label it as a false signal, and then immediately you refocus on something else without mercy, without looking back to see if it, oh, I should check it again, or I should do that and that, I should analyze it. Okay, no. If you say this is an obsession, this is an OCD, if you say this is a false signal, then this is a false signal without looking back, okay, without suspecting, without doubting that this is an OCD signal. No, you say OCD signal and you immediately refocus. Uh, if this is difficult for you, first you, of course, you will try it. If this is difficult for you because your OCD is a harsh one or is an aggressive or a hard one, then we are left with the second choice, that you enter or you touch the border of the story. You touch the OCD. You will enter a little bit the OCD. At least in the exercises of step two. Why? Because you are taking a dangerous step. We have said many times that if you focus, if you give the OCD signal attention, then you will increase it. Then you will say, at least to the brain, when the brain throw to you an OCD signal, a false signal. Any reaction that you do to this signal, the bigger the reaction, it will indicate a sort of importance to the brain. The bigger your reaction, that you will do towards this brain signal, the more the brain will understand, oh, it is an important. So this is why until now, step one, step three, directly, immediately, the intention of us is that, the intention of the therapy is that you give as much importance, as little attention, as little focus as you can to the OCD signal. This is why we say, at the moment you recognize that it is an OCD, you refocus. At the moment you label it, this is a false signal, and then you refocus. As you see, if it is a mild form of OCD, a soft form, then you will benefit a lot. Maybe within 1-2 weeks, you will see a clear, a very obvious improvement. Okay. If not, then you will enter step two. This is touching the content, but in the exercises, maybe you will go more in the content, or deeply in the content, more deep in the content, not only touching the border of the OCD. Okay,